discuss those issues during this panel. I want to welcome everybody. Thank you for joining me this morning. I hope it's warmer where you are than it is here. I'm sitting in the office with a heater right beside me. Well, Linda's in Ballarat, guys, so it's a bit cold up there, isn't it, Linda?
Oh, yeah. Tell me about,
I know, it's okay. When I go and see Linda, I rug up because I'm a pathetic Melburnian who doesn't like the cold. Gemma, welcome aboard. Gemma's a palliative care nurse. Your presentation was phenomenal. Thank you very much. On a personal note to Linda and Melissa, thank you so much for sharing your stories about Dad and about Em. It was my privilege to know both of them. And just a message from not only myself but the team, their passing was affected the team, and we really miss them both. They were very similar in personalities, I have to say, both very stubborn. You didn't have to kind of figure out where they were coming from. They were extremely direct with you around where they stood. And I remember your dad, Melissa, giving me advice. Our photocopier machine broke down in the office and he gave me some advice on how to fix it. God love him, thinking I'd be able to know how to do that. But anyway, he did try. And Em always kept me on my toes, Linda, as you know, always. So I really thoroughly enjoyed both your presentations in relation to both John and Em. So thank you so much. It was a real privilege to be a part of that.
Well,
thanks, Tammy.
And Gemma, welcome aboard. And as I said to the last panelist, now we have you here. Good luck on escaping.
Thanks.
So I probably, Gemma, if it's okay, I might start with you given the poll results, because there seems to be a great deal of interest around accessing information. So one of the questions we asked is probably how to start the conversation with your family member, or even if it impacts yourself, how you could start the conversation with your family about your own wishes. What would you advise in that respect?
I think certainly from what I've experienced in my practice is having those discussions early, and that's been something that's actually come up quite a few times in having listened to the other presentations. It is incredibly difficult to have such really deep and sometimes really negative conversations about reality. But I think if you discuss it early, you really start to appreciate your loved one and what they want, what they wish for, so that you can actually act on their behalf the whole way through. I find from my personal experience and my professional experience, it actually also reduces the amount of distress that the person suffering the disease, but the family also have to suffer through. And yeah, it's really about leading those early.
So just even maybe just having a starting point, no matter where you think that might be, there's sort of no wrong or right answer around that, just starting the conversation.
Absolutely.
Yeah. And Melissa, I know, and I'll come to you, Linda, in a moment, but I know, Melissa, you and I had that discussion in relation to Dad, because I'd sort of said to you, his funeral service was so extremely well done. And I know that it was difficult because you weren't really sure what Dad's wishes were.
Yeah, it took us, well, he had a lot of things in place already, which was really good for us, mostly around his finances and his actual care, like when it came to palliative care at the end, and who was to be looking after all of that. So that was really good. But yeah, when it came to the actual funeral service itself, he didn't really give us very much direction as to sort of where he wanted to go with that. But we were just lucky that we still, like, my mum was still very much involved with our family. So she knew him at knew him at a time, like, because knew a different part of his life, which it's hard for a child to plan. To plan a parent's funeral when you don't really experience that part of their life. So yeah, it was good to have Mum there to sort of fill in the blanks, and then also his siblings as well, he's one of 5 siblings, so there's a number of other gaps there that we were able to fill with the family, but otherwise, yeah, Dad didn't really give us a really good idea as to what he wanted. And it was a bit tricky too, because we did have to sort of work with the COVID restrictions too. So we did have limits with numbers and everything. So we did have to live stream his service. But it kind of worked in our favour, because probably towards the end, it probably was going to be a smaller service anyway. But and a lot of family are interstate, so they could actually live stream and didn't have to actually travel here. So it sort of worked out well for us in the end.
So it was helpful to have, so Dad had medical power of attorney, and he'd sort of had the financial, so he pre-planned his funeral from a financial perspective, so he didn't have those worries. But it was really around the wishes around how he would want to be remembered was sort of the challenging phase for you and your family, wasn't it?
Yeah, definitely. Yep. Yeah.
And so probably in hindsight, what would you sort of say to people who are listening today in relation to that part of the challenges that you guys were facing?
Yeah, well, I think if you don't have a lot of people around who could kind of put something together at the end, I think it's definitely very important to be able to communicate what you want out of your service and how you want to be remembered, so that somebody does know sort of how to put it all together. Definitely having that funeral insurance made it really easy for us, because the application to actually get that sorted out was really straightforward as well. Like the funeral company didn't make that very difficult to access, and they just transferred us the money, and then we could use it in a way that towards the service, definitely, so the funeral insurance definitely helped out there for us.
I did personally enjoy some of the hairdos and clothes your dad was wearing in some of those photos, I have to say. He would probably kill me for saying that, but I did enjoy that. I had a bit of a smile as I was watching.
He's a bit of a character, that's for sure. Yeah.
He explained to me about jazz music, I have to say. Linda, with regards to Em, you had a similar experience to Melissa, didn't you, when it came to trying to do the best you could by Em in terms of how to remember her?
Yeah, at the time, everything was a bit of a blur, actually.
Yeah.
It was, it all happened so quick with Em all of a sudden. We didn't really have anything in place. We knew Emma's time was coming up, in probably a few years to come, but it all of a sudden happened quick with Emma, because she had cancer as well. So everything was just really quick. There was no funeral plan. There was no power of attorney. There was nothing that had happened. It's a long story, but I tried to get the power of attorney.
I did.
But was unsuccessful. And then everything just sort of spiraled with Emma, her life, her health. And then, we were told that she had this cancer, and she only lasted 5 days before she passed. And everything was just like rushed, and we just had to try and do the best out of what we could. But Emma had no wishes. She wasn't able to communicate in the last few years. So we had to make her memory a day of what she loved, what brought her the most joy in life, her music, She had cousins up and speak, and just her colours and just stuff that she liked. Yeah, it was it's still a hard time thinking about.
Absolutely.
But even though you didn't, both of you, to Melissa and Linda, even though you didn't actually have a direct response from Dad and from Em about what they wanted, can I say that both services were beautifully done, and very representative of what I knew about both of them. The people that spoke on their behalf. I actually learned something new about both Dad and Em. Can I just tell you that I didn't know? So I was upset that I hadn't known that.
Stuff about Emma.
I know. I went, oh my goodness gracious, I had no idea. But Gemma, given what both Melissa and Linda have discussed, and thank you for sharing those very personal experiences, and the poll results, there seems to be a lack of knowledge about advanced care directives, wills and powers of attorneys. Could you possibly discuss how helpful those documents can be and why they're so important?
Yeah, of course. So an advanced care directive is a document whereby you sit down with the relative and have them fill out information that really breaks it down in layman's terms. It says things, you know, with the expectation of, do I want to be resuscitated, is one of the big questions. It's often really confronting with most families. But it also comes down to, what level of treatment do I expect from a doctor? Say if I presented to an emergency department, I want, you know, IV antibiotics, but I don't want tubes stuck here or whatnot. So it makes it really quite simple. And that document does travel everywhere. We in the hospitals have that actually attached to the patient's medical records. So the expectation, obviously, if they do present into hospital, is that gets read, and it is a directive of what medical teams follow that is in line with the patient's wishes. So that's, in short, an advanced care plan, without getting into the crux of things.
Beautifully explained, Gemma. Thank you.
I often just keep going, so just stop me.
No, you go. No, you're doing beautifully. You go for it.
A medical power of attorney is a bit different. Again, it's a legal document whereby you're appointing a spokesperson, family member, a close friend, as your spokesperson when that person cannot articulate what they're wanting, and it's often next of kin or someone within the family. And as we know, with Huntington's disease, as it progresses, it is very difficult for patients to communicate. Therefore, their best person is a medical power of attorney. And medical powers of attorney work well with advanced care directives, because that medical power of attorney can carry that document and also still advocate for their loved one and say, hey, what are you doing? We need to work this out. And they work with the neurologist or the doctors who are around that person at the time to make sure that they're getting the best care that everybody is expecting.
Yeah.
With a will and testament, that is something that takes over after our loved one passes away. So that is where you're talking more about the estate. What I mean by that is that individual assets or businesses, and being able to allocate. Obviously, a lot of people would be familiar with wills, but where estates or valuables go towards. But that is something that takes effect after the fact that somebody has passed away. I think all three documents altogether are quite important to be completed, because, as I sort of touched on before, and what I see in a lot of patients who are entering in what we say the advanced stages or a terminal stage of illness, that they're madly rushing to get it all done. And what's often happened, and probably what Linda had experienced potentially, is that there is you need to be competent to sign legal documentation, and if there's a question that somebody doesn't have the capacity to be able to sign that's when it legally cannot proceed. And there it is a little bit, and a lot more actually complicated, just going in that stage.
Thank you. That summary was really concise, Gemma, and very easy to understand, so thank you. Linda, did you want to say something?
Yeah, look, I agree with everything she says. I think care planning is a very important thing.
Yeah.
And the power of attorney, coming from experience, mine's a totally different story. But I think as soon as a person is probably tested positive or and has the disease, it's the story of bringing up the conversation. That was a big, because you're always scared to talk about it and you don't know how to bring it up. In Emma's case, if I'd brought it up, she probably would have said, "Oh, Mum, shut up."
I think she would have.
But I think to bring up, try and get the conversation going, to talk about your advanced care planning, which really is a tremendous idea. I agree with that wholeheartedly. In a lot of, I could feel a lot of stuff with Emma in the advanced care planning that, she could have had at a certain time.
Yeah.
And as for the power of attorney, we did try to get that, but her doctor at the time said that she didn't have the capacity. I do feel just at that time she still did, but it all just sort of fell to pieces then. And that's when, everything's taken out of a person's hand and a family's hands. So it is really important that people do these things. I agree with it. Yeah.
No, thanks, Linda. Melissa, do you want to add to that? Because I know that Dad did have some documents in place, and maybe just discuss how, I suppose, that helped you and the family by having that in place.
Yeah, absolutely. Because, so Dad had nominated me as his next of kin. So I was definitely able to, like, anytime I had to fill out an NDS form or something, I was always able to easily sign that one on his behalf. Because I suppose with Dad, we had been managing this for a really long time. So it'd been, I can't even, maybe 20 years or something now. I kind of lost count, but it was pretty early on that he did choose me as his next of kin. So that was a pretty easy transition. But the medical power of attorney for him, I just didn't feel that I was the right person for that. So just because I absolutely can't handle anything medical, it's just not the way I think, and I just am not the right one. So my auntie, so my dad's older sister, took on that responsibility. So it was sort of both of us working together to help and support him. And so my auntie it was the medical power of attorney, and then I guess it was she had the responsibility of the decision making around his care in his final days. So that meant that I could actually spend those last few days with him without having to worry about that sort of thing as well. So I could actually just be there to support him instead of having to worry about what the doctors were saying and everything as well. So that did work very well for us. But in saying all of this as well, on a different, sort of after watching the videos today and things, I think I've got a few things I need to get in place myself. Because I don't have a will and I don't have a medical power of attorney for myself, and I am HD positive as well. So certainly things that we do need to have those conversations in our family too. So just to put things on the other foot.
Well, Melissa, I think you raised some really valuable points that, can I say, I think regardless of Huntington's, everybody should have those in place. I'm sure Gemma would agree with me. And as a young, I'm talking for myself, as a young social worker, I was talking to people on the wards about this and turned around and thought I should practice what I preach. So I did it myself. So I think we all should be doing this. But again, your contributions today are informing your community about it, so I can't thank you enough. The other valid point that you really raised was to actually think about whether you're the right person to sit in that position of a power of attorney, because it is a responsibility, and people will be coming to you for decisions to be made, and it's actually okay to say, no, I'm not that right person. So that was a really valid point that you made. And Linda, to say, you know, it's great to have those, you know, if you have these documents in place, then it takes stress from you, and you know that you're acting in the best interest of your loved one.
Yeah.
Yeah.
Now, I'm getting in trouble again because I'm over time. That's not unusual. But before I let you go, Gemma, I really want to just talk about palliative care and what it is, and when people can access it, and what a palliative care team what it looks like.
Absolutely. So palliative care, I guess a lot of people, when I meet them, really just assume, and as I said in the video, that it's just about the end when there's nothing else the doctors can do, and then all of a sudden palliative care takes over. What I often say firstly is breaking that, is we get a lot more heavily involved, or even just lightly involved from the beginning, if there's things such as symptom management that we can actually assist the neurologist or the hospital with. The other thing also that's really important to point out is, even though that I have a label of being a palliative care specialist, that palliative care is actually delivered by multiple different medical professionals, such as even GPs, such as the neurologist. So it's not just that one team that's responsible for all of this. So with palliative care as a general term, it falls in many different areas. So it can be if your loved one's in hospital at the time. It can be if your loved one is going into a palliative care unit, or its other name is a hospice, that's more commonly known as. It's also delivered within a community palliative care service. How all of those points come in to be accessible, I guess, is in very different ways. So again, GPs can even be your first point of contact in terms of being able to start even thinking about things like advanced care planning or medical directives, which is also what palliative care can assist with. The community palliative care teams, the way that they work is based on your suburb of where you live. They have different catchments. And I would say if it was getting to a point where that there were complex symptoms that your loved one was needing a bit of assistance with, there's a role for that. And equally, if your loved one has identified that they're very aware and they're very realistic of what the disease will bring, and they really want to limit their amount of hospital admissions for less invasive measures, that again, a community palliative care service can really try to optimize their time at home. The other part to all of this is the big part, is when there isn't any more acute medical management that we can do. And at that point, we do assess, can we support the family to be able to provide end-of-life care in the home, or are we looking towards a palliative care unit to be able to provide that end-stage care? What we often also forget to mention is that it's not just those two locations. A lot of the time, as Huntington's disease progresses, our loved ones are very difficult to be able to care for in the home environment because their care needs are just excessive. Carers fatigue is a big thing for those that do come in to provide that additional care, but it does fall a lot to the family, and we do need to transition into an aged care facility or a nursing home. Palliative care can still access and support the nurses in the nursing home in that same setting. And we have had very successful end-of-life management in nursing homes as well. So this is what I mean. And I guess it seems really messy, but the message I want to get across is that it's very fluid. It can come from any angle. It can come from multiple people. But at the end of the day, it's all about quality of life and what that person and their family really want and what their priorities are.
Yeah, thank you for that explanation, Gemma. And our experience has been very much as you described. We, particularly when we have some of our community members in aged care facilities, we've worked very collaboratively with palliative care teams who support the staff at the residential care facility and the family, and we've found that partnership has just been phenomenal. So I'd absolutely reiterate everything that you've said. For me, given everything that you've all talked about, the take-home messages are that you can be proactive in this space. Earlier rather than later is better.
Absolutely.
That not only will it take some of the stress from yourself as an individual, but it also enable your family to feel confident and comfortable about what your wishes are, and they've given you the legal documentation to enable you to enact on their behalf if they're not able to do it themselves. And that the palliative care services can be accessed by anyone who have a life-ending diagnosis, and that, as Gemma's just rightly pointed out, it's very flexible. It's around supporting that person and their family in relation to quality of life. Did I summarise that okay, guys? Did I miss anything?
You never do. You never do.
I do sometimes. I have gone over time, so I'll be in trouble as per usual, but I couldn't help it. There were so many great things you're all discussing, I couldn't end it. I can't thank you all enough. I have absolutely thoroughly enjoyed this session. I know everybody else would as well. Thank you for giving up your Saturday. I hope you're all nice and warm. Have a lovely rest of the day, and I'm sure I'll speak to you all soon.
Yeah, absolutely. Thanks, Tammy.
See you. Bye.
Bye.